What should I do if I get scratched by a cat?
Hey there! Welcome to today's video, where we'll be discussing what you should do if you get scratched by a cat. Cat scratches can be painful and potentially lead to infections, so it's important to take appropriate steps to care for the wound. Let's get started.
Assess the severity of the scratch.
The first thing you should do is assess the severity of the scratch. Minor scratches that break the skin but don't bleed excessively can usually be treated at home. However, if the scratch is deep, bleeding profusely, or if you notice any signs of infection such as redness, swelling, or pus, it's best to seek medical attention.
Clean the wound.
If the scratch is minor and doesn't require medical attention, the next step is to clean the wound thoroughly. Start by washing your hands with soap and water to prevent introducing any bacteria to the scratch. Then, gently clean the scratch with mild soap and warm water. Avoid using harsh antiseptics or hydrogen peroxide, as they can damage the tissue and delay healing. Rinse the wound well and pat it dry with a clean towel.
Apply an antibiotic ointment and cover the wound.
After cleaning the wound, apply a thin layer of antibiotic ointment such as neosporin or polysporin. This will help prevent infection and promote healing. Cover the scratch with a sterile adhesive bandage or gauze pad to protect it from further contamination. Change the dressing daily or whenever it becomes dirty or wet.
Monitor for signs of infection.
Even with proper care, cat scratches can still become infected. It's important to monitor the scratch for any signs of infection, such as increased redness, swelling, warmth, pain, or the presence of pus. If you notice any of these symptoms or if the scratch doesn't seem to be healing, it's crucial to seek medical attention promptly.
Tetanus vaccination.
Cat scratches, especially from outdoor cats or cats with unknown vaccination history, can carry the risk of tetanus. If your tetanus immunization is not up to date or if you're unsure, it's advisable to consult a healthcare professional. They can determine whether a tetanus booster shot is necessary based on the nature of the scratch and your vaccination history. That wraps up our video on what to do if you get scratched by a cat. Remember, assess the severity of the scratch, clean the wound thoroughly, apply antibiotic ointment and cover the wound, monitor for signs of infection, and consider tetanus vaccination if needed. If you have any concerns or the scratch worsens, please don't hesitate to seek medical advice. Take care of yourself and your feline friends.